I'm Mark Green. I'm the Managing Director of the Malaria Policy Center, and I guess by way of background, 2007-2008 I was the United States Ambassador to the United Republic of Tanzania. Before that I spent 4 terms in the United States House of Representatives, and actually before that my father is a South African doctor, so really going back a long ways I hope I had a sensitivity to some of the health-based challenges in different parts of the world, especially Africa, but also in particular malaria, because 20 plus years ago when I was a volunteer teacher in Kenya, my wife and I each caught malaria. On top of that, when I was ambassador, I helped to run one of the more successful malaria programs in the world, and really saw firsthand both the challenges of malaria and also what it means to actually reduce malaria and the benefits that that has. I think malaria, when you talk about malaria, it really depends on whom you're talking to. A lot of people don't realize just what malaria is and how it's carried and the devastation that it brings. But I think if there's one sort of universal message that one should communicate, it's that we can solve this, we can tackle this, we can end malaria deaths. There's a lot of talk these days about different causes that we should take on, and so many worthy causes are out there. But I think what makes malaria different is that we know precisely how to fight malaria. We know that using insecticide-treated bed nets, indoor residual spraying, medicines designed to prevent intrauterine transmission of malaria, and of course access to ACT, the principal drug to fight malaria. We know that they work. We know that malaria is preventable, and we know that it's treatable, and that we know by using these interventions we can end malaria deaths. That's something to me that really sets us apart. It really makes it a cause worth taking up. I believe that if and when we conquer malaria deaths, we will have brought the world together behind a tremendous cause that really will make a difference in so many families' lives in Africa and other parts of the world. But we will have also built up momentum for development, for lifting lives and building communities in Africa that we can use to take on so many other challenges. We always refer to conquering malaria as the first great humanitarian victory of this century, because that's how we view it. It's a victory we can achieve, and it will be just the first step, a major one, but just the first step in really changing the course of human history. Well, I think what's important to understand is that malaria is something that is real, that you have to humanize it. You have to help people understand just what malaria means. Now, one thing I think we're guilty of, I think we tend to talk too much about mortality. In other words, the deaths that malaria causes. And certainly that's our main focal point when we talk about the challenge. We want to end malaria deaths in the world by 2015. But what really struck me in my last trip back to Tanzania was the morbidity, what it means in terms of those who survive. I was struck by meeting 2 very young children, about 1 year of age. In each case they were profoundly cognitively disabled, and they were so because they were struck with cerebral malaria in their first day of life, and the raging temperature had destroyed part of their brain. They face for the rest of their lives tremendous challenges, and of course so do their families and their communities as they try to figure out ways of dealing with this. On top of that, I think you have to remember that malaria, for those that it doesn't kill, also really saps them of their economic vitality. When you talk to employers, when you talk to economic development leaders, they'll tell you that it's a major hindrance to getting ahead. The lost work days that come from malaria, the costs in terms of the part of the public budget that is taken up in fighting malaria. So when you talk about malaria, you have to talk about it in very real personal terms, that this is something that is the largest single cause, single disease death for young children in Africa. And I think you also need to remember that malaria has a devastating effect just beyond just those whom succumb to it and die from it. It really robs communities of their economic strength and, quite frankly, their future. I think when it comes to policymakers, particularly elected officials, they tend to hear all the time about things that don't work, about programs that don't work, problems that are insurmountable, and if programs do work, why they won't work pretty soon. In the case of malaria, we have a really good story to tell. This is an uplifting story. President's Malaria Initiative, PMI, together with the programs that are funded by the Global Fund, which is 2/3 of all the malaria projects in the world, it's actually working. When I look at Zanzibar, which is part of the United Republic of Tanzania where I served, in Zanzibar, malaria deaths are below 0.2%. It's extraordinary. Just 5 years ago, you would go into hospital wards and see 3 young children to a bed. Now you go to those same wards and they're empty because we know precisely what to do. These investments are working, and this is something that everyone should be able to get behind because it's proven, it's verifiable, it's measurable, and really success is on the way. So we thank our policymakers and we ask them to help us finish the job. First off, I'm thrilled that you've taken the time to learn more about malaria and learn more about how you can become involved. This is a cause that really has touched my heart, obviously with what I'm doing, because I've seen malaria, the devastation it causes, and I've also seen the results of the investments that we're all making. So the fact that you're willing to put your time, your energy, your talent behind this cause is something that's very encouraging to me. And I strongly encourage you to keep it up because we'll be able to look back on this. I'm convinced of it. 5 years from now, 10 years from now, we'll be able to look back at this as an extraordinary time. And you'll be able to tell your kids, you'll be able to tell your grandkids that you were there, that you were part of the cause, that you were someone who didn't just sit by and talk about it or read about it, but actually invested time and energy into this cause to see it through to victory. So thank you for that, and it's something I hope you feel good about because you really should.